Hi, this is Sebastian. I'm a Pilates teacher and today I'm gonna show you the basic of the Pilates breathing. So, Pilates breathing. Some of you probably have done some Pilates classes in the past. You might be already acquainted to it, but just in case, let's do a little bit of reminder of the basics of the breathing pattern in Pilates. So, as you know, or some of you know, the inhaling work is done by a muscle called diaphragm, which comes here in front attached to your ribs, all around, all the way back to your spine. The diaphragm has a shape that is about the shape of a head of a mushroom, and when it contracts and gets shorter, it's going to actually draw air in by pushing your organs and the liquid inside of your belly down and out, as it helps to increase the volume inside of your lungs and your thoracic cage. Now, the important aspect of Pilates breathing is the other muscles that start to work after you inhale and stop. So when you have inhaling, then the next step is exhaling. Most of the exhale work is done by a muscle called the transverse. This muscle is attached all the way to your spine, covers all your abdomen. It's kind of a really big belt, and it comes attached all the way here under your ribs, up, all around. So it comes attached at the same spot where the diaphragm attaches itself, but it's also attached to the spine and down to your pelvis, inside the pelvis. So the action of the transverse itself is actually to make yourself thinner. So as you exhale, try to feel what works. Push the air out completely. And try to feel the muscles that start to burn. The muscle you should feel starting to burn when you exhale the air completely and you keep pushing completely to expulse all the air, while this burning muscle is your transverse. This is your exhaler muscle. So, in Pilates, in fact, the focus is on the work of the transverse muscle. Now, it's a counterintuitive way to breathe. In fact, if you practice yoga, you probably kept practicing to have your belly out and focus more on a diaphragmatic breathing pattern. This is yoga. Pilates, we work differently. We work with the transverse and we work with the focus on exhaling completely the air out. Just so happen that by doing this, you're taking the habit of protecting your lungs. How? It has to do with the anatomy of the lung. Let me explain. So, if you look at anatomy planks, the inside of the lungs, if you look at the outside, the lungs is made as a bag. But that's not how the lungs is inside. So if you look at the bronchioles, where they get attached to small bags. In fact, they get attached to a lot of small bags into a grape. So this is the alveole. This is where the oxygen-CO2 exchange happen. This is where the breathing happen. What you need to know is those alveoli, the skin of which they're made, is not an elastic tissue. It cannot change its volume. So if you can purge the air completely out, there's no danger. So you can really push your transverse to your maximum capacity. But on the inhaling part, there's a maximum of inhalation you can do. In fact, if you inhale beyond your maximum capacity, you take the risk of tearing some of your alveoles. And if it ever happens, this compromises your ability to breathe. And if you don't know, if you can't breathe, you don't live. And if you take the bad habit of always breathing to your maximum capacity on the inhale, you're also taking the bad habit of pushing to the limit where at some point your alveoli might break. In fact, when people get on machines to help themselves breathe in because, for example, they have a pneumonia caused by COVID and they cannot breathe on their own now, well, if by accident the machine pushes too much air into your lungs, it can cause the break of one or multiple alveoles. And when this happens, the oxygen exchange into your lungs is compromised. You cannot breathe properly anymore because the air goes out of the lung into the volume between the lung and your ribs, and in this volume there's not really that much oxygen exchange that can happen. This part of your lung is not designed for that. It's really your alveoli that are designed to optimize the exchange of oxygen and CO2, so you can exhale completely the CO2 and inhale as much oxygen as possible. So in other words, when you practice your Pilates breathing method, what you're training your transverse to do is to act as a safety belt for your alveoles. In other words, you're always going to exhale completely when exhaling, and when you're going to inhale, you're going to keep your transverse contracted. This way, your diaphragm won't be allowed to go all the way to its maximum. It's always going to stay to maybe 80, maybe 90% of its maximum capacity. And each time you exhale completely. So in other words, your transverse is going to prevent your diaphragm to inhale so much air it might damage one of your alveoles by accident. The other thing that also happens when you learn to breathe this way is you learn yourself to purge completely the volume of your lungs at each breathing. And if, for example, you contract a virus, what happens is that if you push the air out completely each time, well, you're preventing yourself from having a volume of dead air that always remains into your lungs. Let's see the opposite. Let's say you get a virus and you don't have the habit of completely exhaling each time. So you're always going to have this volume of air that stays and remains always into your lungs. If you get an infection, for example, an infection of the lungs, and one cell is infected and start to emit viral particles, well, instead of being purged out, those viral particles are going to remain in the small volume of air you never exhale. And if you allow this, well, you are more at risk of reinfecting yourself or seeing the symptoms of COVID to evolve much faster than otherwise if you had the habit of exhaling each time properly. So that's the basic of the Pilates breathing technique. Now stay in touch. This is just my first video for YouTube, and the next videos I will also start to show you the basic gymnastic exercise that comes with the breathing method of the Pilates method. So stay tuned. Thanks for watching and have a good week.